Hello everyone, this is Dr. Sachin, and first of all I will like to welcome you all on Focus World Virtual Conference. Here I will be presenting you a case of peripheral neuropathy, emphasizing the role of ultrasound in evaluation of peripheral nerves. The aim of my presentation is to explain the role of ultrasound in peripheral neuropathy. We'll learn to compare the appearance of normal versus pathological nerve on ultrasound. I'll be emphasizing the importance of nerves while doing doctoral studies as well. And I'll explain why not all the non-healing ulcers are due to vascular etiologies. Some of them may be due to neuropathic etiologies or nerve etiologies. I'll be covering this presentation in the following sequence. First of all, I'll be presenting a case of non-healing ulcer over left heel with the help of clinical pictures and clinical observations. It will be followed by radiological evaluation with the help of radiological videos and images, including the radiological findings and final conclusion. And at the end, I will be explaining you the appearance of normal versus pathological nerves on ultrasound. So here comes the clinical case presentation. This is a 24-year young male presenting with chronic non-healing ulcer, which is painless and present on the left heel. The patient was actually referred to the radiologist for lower limb Doppler studies to evaluate the possible cause of peripheral vascular disease. This is the clinical picture. As we can see, there is a large non-healing chronic ulcer present on the left heel, which is quite deep, almost reaching the bone. The important clinical catch over here is this ulcer is painless, and all of us very well know that painless ulcers are due to nerve pathologies, and vascular ulcers are very much painful. This case was evaluated with the help of 3-7 linear probe. This is a video showing evaluation of left lower limb neurovascular bundle. As we can see, the left lower limb arteries showed normal caliber echo-free lumen and they showed normal triphasic flow pattern. The left lower limb veins also showed echo-free collapsible lumen. However, it was noticed that the nerves accompanying the left lower limb vessels, predominantly below the level of knee, showed progressively increase in the cross-sectional area and altered ecotexture. This is anteriotibial artery, and this is the nerve accompanying it. We can see the significant increase in the cross-sectional area of the nerve. This is another video showing the evaluation of left lower limb neurovascular bundle. This is posterior tibial artery. As we can see, the tibial nerve in the proximal part showed normal echo and cross-sectional area. As we are tracing it down in the lower limb towards the ankle, there is change in the ecotexture of the nerve and progressively increase in the cross-sectional area. Over here, we can see there are prominent fascicles, hypoechoic nerve fascicles, which can be seen, and there is progressive increase in the cross-sectional area of the nerve. These are the prominent hypoechoic nerve fascicles. The left posterior tibial artery is absolutely normal. This image is showing appearance of the sciatic nerve in the same patient in the hamstring region. As we can see, both the sciatic nerves in the hamstring region show normal cross-sectional area, which is comparable on either side, and the ecotexture or appearance of both the nerves is almost equivalent and normal. This is the picture showing the tibial nerve accompanying the posterior tibial artery. In the proximal part, we can see on right side, there are tibial nerve is showing normal echo appearance or normal echo texture, the nerve fascicles are of normal size. Comparatively, at the same level, the left tibial nerve is showing prominent hypoechoic nerve fascicles and increased cross-sectional area. In this part, the part of nerve is showing hypoechoic appearance and the part is echogenic. This image is representing the appearance of anterior recurrent nerve, which is also known as deep peroneal nerve, in the lower leg region, accompanying the anterior artery. These are the anterior arteries on right and left side respectively, and that is the anterior recurrent nerve. On the right side, the anterior recurrent nerve is showing normal appearance, normal cross-sectional area. Comparatively, the left tibial anterior recurrent nerve or deep peroneal nerve is showing hypoechoic echo and significantly increased cross-sectional area. Multiple prominent hypoechoic nerve fascicles can be seen as hypoechoic dots over here. On screening, the left lower limb arteries, all the left lower limb arteries show normal traphazic flow pattern, as well as the left lower limb veins show normal flow with compressible lumens and increase in the flow or augmentation of flow on distal compression, suggestive of normal appearance. So radiologically, at this stage, we could conclude that the ulcer, chronic non-healing ulcer in this case was due to nerve etiologies and not due to vascular etiologies. There was significant increase in the cross-sectional area of left tibial, common peroneal, and deep peroneal nerves with altered echo texture, that is hypoechoic echo, suggestive of peripheral neuropathy. While the color Doppler flow imaging was absolutely normal. So, in this case, there was peripheral neuropathy affecting left tibial, common peroneal, and deep peroneal nerves. So let's learn the appearance of normal versus pathological nerves on ultrasound. Normal peripheral nerve on longitudinal sonogram will show the peripheral most continuous echogenic line suggestive of epineurium of the nerve. Towards the center, there are multiple hypoechoic bands surrounded by a discontinuous hyperechoic band. The hypoechoic bands in this region represent the various nerve fascicles, while the discontinuous hyperechoic bands or echogenic bands represent the perineurium. Sorry. On transverse sonogram, again the perineurium will be seen as curvilinear, continuous echogenic line at the periphery, and at the center we can see multiple hypoechoic dot-like structures representing the nerve fascicles surrounded by echogenic structures representing the perineurium. Pathologically, the peripheral nerves can represent various appearance, can show various appearance in different diseases. There can be homogeneously enlarged nerve, non-homogeneously enlarged nerve with multiple prominent hypoechoic fascicles. As we could see in this present case, there was prominent hypoechoic fascicles and the cross-sectional area had significantly increased. The nerve may show partially echogenic and partially hypoechoic components. As we could see in our case also, the tibial nerve in the proximal part shows mixed echogenicity. The nerve may show increased cross-sectional area with loss of normal fascicular architecture. There is no fascicular architecture seen in this. The nerve is diffusely hypoechoic and there is significant increase in the cross-sectional area seen in this region. At times, the nerve may show increase in the cross-sectional area in a given region and the rest of the nerve may be normal. In a limited region, it may show altered echo texture and rest of the nerve may be normal. At times, the nerve show enlarged cross-sectional area, but reasonably normal fascicular architecture can be seen. There may be normal cross-sectional area with distorted architecture as well. So these are the various kinds of appearance of the pathological nerves which we need to evaluate while evaluating the peripheral nerves on ultrasound. So at the end of this presentation, my take-home message is that you should always keep your nerves to evaluate the nerves during the Doppler studies as well. Not all the non-healing ulcers are due to vascular etiology. Some of them may be due to neurological etiologies. So always look for nerves, even if you are doing a Doppler study as well. These are the references I used. Thank you very much and have a good day.